So at that point, the NIMH mounted what they said is going to be the first well-designed long-term study of the effects of stimulants on children. It was called the MTA study, the multi-site, multimodal treatment study of children. You'll see it's heralded as, we're finally really going to assess whether these medications help children over the long term. You'll see, where are we now? What is our knowledge out in 1994? You'll see the third thing. At this point, we have no evidence of long-term benefit. You see this, right? Okay, now here's how the study is designed. It's basically 4 different arms. It's either medication alone in the community, medication as alone but as prescribed by experts in ADHD, and then it's behavioral therapy or a combination of the two. And here's the 14-month results, and these results were publicized widely because it was seen as there was now evidence that the medications provided a long-term benefit. And by the way, this is the outcome still often cited in clinical care guidelines as proof of a long-term benefit. Just so you know, it's coming from this study. And you'll see lower ADHD symptoms, and it seems like some of the kids were doing better on reading tests in that group prescribed stimulants by experts. Okay, that's what they're really reporting here. And they say, you'll see the bottom, since ADHD is now regarded by most experts as a chronic disorder, ongoing treatment often seems necessary. This is the study that says we should be keeping these kids on the medication. So it's randomized. That's your 14-month results. I will say, in my opinion, it was a little bit biased against the behavioral group, because whereas the drug-treated group got to continue to see psychiatrists for 14 months, the behavioral therapy ended like after 5 months, 6 months. And if you believe that going to see a doctor just regularly besides the therapy is helpful, one group did not get that, okay? But the study continues. It now becomes a naturalistic study. Whatever group you're in, you're free to go on drugs, or if you've been in any group, you're free to go off drugs, and now they're just going to follow the kids. And here's what they reported at the end of 3 years. And you'll see this. By the end of 3 years, medication use was a significant marker not of beneficial, but of deterioration. In other words, they had increased symptomatology related to those off meds, a little bit slightly smaller and higher delinquency scores. 2 things. Do you think this result was publicized widely? It was not. So whereas there was a big press release by the NIMH at the 14-month results, this one was not publicized in any way. The other thing here is this. To understand this, what they really mean by this. Let's imagine this is the medicated group and this is the unmedicated group. This medicated group actually still has scores better than at baseline, okay? So your ADHD scores are still better than you were at the beginning of 3 years. The point is this unmedicated group is doing even better, okay? So that's the comparison. It's not that this group is doing worse than they were initially. It's just comparative to the unmedicated group. Here's the 6-year results. You'll see, again, medicated kids who stayed on the medication had worse outcomes, worse ADHD, greater overall functional impairment. Now, as you might imagine, the researchers were puzzled by this. They didn't expect this. And so now they began to do different analyses to say, okay, maybe the reason for the poor outcomes with the medicated kids is they were worse off. They were more severe. Or maybe there's some class difference. So they're going to try to find some factors that explain the worse outcomes. They don't find them. And they do something called a propensity analysis to do this as well. In fact, they find, if anything, it should be the medicated group that has the better outcomes, just based on class, severity of illness, etc. So you can see in here a group that went through, tried to analyze the data, tried to explain the poor outcomes, and says, we can't find an explanation for it. And you'll see this, they didn't catch up growth, that sort of thing. So this is William Pelham. He's a psychologist. He was one of the investigators. By the way, they had quite a fight among the investigators about what to publish. The psychiatrist and the psychologist really got in a fight over this. He was one of the psychologists. Now, he was afraid, frankly, to say this in the United States. He went to UK and he was asked, what were the results? You'll see. We had this expectation. The medicated kids would have better long-term outcomes. What did we find? We found some short-term benefit, but we didn't find a benefit on any domain of functioning. And here's, I think, the key. In the short term, medication will help the child behave better. In the long run, it won't. And that information should be made very clear to parents. How many Danish parents are told about this when medications are offered? That's the problem, right? At least it should be done within within this field of free sharing of information. I can guarantee you no American parent is told this. So, the MTA study is still cited in clinical care guidelines as the best study ever done, and usually you'll see the 14-month data study showing that this is why we use these drugs long term. But now let's go and see what other studies might be out there that bear on this question of long-term outcomes. You'll see this is a Canadian effort to see if these medications are improving long-term. They look at all the studies they can find that lasted longer than 3 months, and they say, little evidence for improved academic performance. Now, this was a study done by the Oregon Health and Science University. It's called a Drug Effectiveness Review Project. It's sort of like the American version of the Cochrane Collaboration. It's done by researchers from 13 different universities. They do not take pharmaceutical money. So what they did is they canvassed the entire literature they could find, all of the evidence. Okay, and what do they conclude? No good quality evidence on the use of drugs to affect outcomes relating to academic performance, delinquency, social achievements. And they said, 2,000 studies, we don't have evidence, we're helping these kids long term. Then Western Australia did a 10-year study. Again, I think the expectation was that the medicated children would do better, but at the end of the 10 years, the medicated children were 10 times more likely to be identified as doing poorly in school than the ADHD children without medication. And you'll see there was a little bit worse ADHD symptoms in the medicated group, higher blood pressure. What's the conclusion of Western Australia? I'll let you read it. I think you see this, different countries are trying to figure this out, and they're coming again and again to the same conclusion. This is just a short thing. Medicaid in the United States is for poor children, and the idea here was some poor children were not getting access to needed care. So they did a study looking at the medicated children with ADHD who got treated versus the medicated children who were not treated for ADHD. And you'll see, unfortunately, those receiving care had worse outcomes at the end of 1 year. This was actually pretty significant. Now, this is a really interesting study that I don't totally understand the methodology, I'll be honest with you. The context for it is this. If you, in Canada, even though they have national health care, there's differences by province. And there was, in the early 1990s, Quebec passed a law which dramatically increased access to prescribed medications without a copay. And as a result of that, up until that time, their use of ADHD medications was consistent with other provinces, but after this they became a heavy user of ADHD medications. And again, I do not understand the methodology, but now they follow kids, they do a long-term study, and again you can read the outcome. Now this is done by both US and Canadian researchers. One of the group has an expertise in actually economics, and you'll see it's all negative. You can read it. It's negative in terms of parental relations, delinquency, anxiety and depression. You see this? Increase in anxiety and depression. By the way, that also showed up in the MTA study. There was a higher risk of the medicated kids suffering anxiety and depression at the end of it. Again, so negative. Alan Sroufe, I don't know if you saw this name. He was one of the psychologists that showed up in those very first studies we were talking about how it affected kids more subjectively. So he's been studying this now his whole adult career. And here's what he told the New York Times in 2012. So we've been studying this for 30 years. Do they increase concentration? Yes. But when given to children over long periods of time, they neither improve school achievement nor reduce behavior problems. And the key is this. To date, no study has found any long-term benefit on attention deficit medication, on academic performance, etc., etc. Again, when we think about the use of medications, long-term, you want to see something on the benefit side of the equation, right? To justify the risk side. And what he's saying is after 35 years, we lack that data on the benefit side. Now, I was given this talk I think I was in Washington a while back, and someone said, but wait a minute, there is now a study that shows a long-term benefit, and it comes from Sweden. And what the Swedish investigators did is they had a database, two different databases that are going to match up. One, they have a database of everybody diagnosed with ADHD, and now they have a database they can see whether those people were filling prescriptions. Okay, so they can see when they're on medication theoretically and when they're not. And then they're going to see, while people on medication, how often they commit crimes, and when they're off, how often they commit crimes. They're going to go to a crime registry, and you'll see what they reported. That they're saying that when people were off medication, they did some sort of criminal behavior at a higher rate than those on medication. And you can see the conclusion here. By the way, this is not children. It's 15 and older, so it's everybody. It's 25-year-olds, 35-year-olds, and 40-year-olds. You do see that it's not following kids, from early growing up. Now, I know, so am I being critical of this study? Yes, I am. But here's what my criticism of the study is. Well, one, it's not following children. But the biggest problem to my mind is this. You actually, if you dig into the study, you have three groups of patients. You have a small group that theoretically took drugs consistently. And then you have about half who took them for a period of time and maybe went on and off. And then you have the never took them group. And what they say is you see more crime in the middle group that went on and off. So the question is, are you seeing a withdrawal effect, basically? And what you would really like to see here, you see here, in patients who had both treatment and non-treatment periods, that's the on and off, the risk of being convicted of a crime was significantly increased. There could be a lot of factors. You stop taking your regular Ritalin, you go to cocaine, I don't know. But what you'd really like to see data here is along all three groups, right? The never medicated, that sort of thing. Then there's one other group, one other study that is now being cited as showing a long-term benefit. It was done by Shire Pharmaceuticals. They fund the study. It was their researchers who did the study. So this is an in-house study by the makers of stimulants. Peter can comment on how accurate he thinks of the quality of these findings might be. But here's what they said. They canvassed the literature. Now, this is the same canvassing of the literature of the people from Oregon that said there was no good quality evidence. These people are saying, listen, we've found 29 studies that show some benefit, 20 that show no benefit, so 29 better than 20, and they say, you'll see this, treatment for ADHD, improved long-term outcomes. So this now is the other bit of publication that is being cited as now evidence for long-term benefit. So, is there any problem with this study? And again, I suppose you can say, maybe I'm coming at this with a critical eye. Probably am. But you'll see. You obviously have, this is by the manufacturers of the drugs. That's number one. You can't find the source studies. They don't tell you what the 49 studies are. The other problem is this. A lot of times there is no placebo group in this study. There really is no unmedicated group. What they'll say in a study, let's look at their baseline scores. Now let's look at them a year later or 2 years later. Are they better? Often they are. But we need to see this natural recovery, right? This natural possibility. And it's missing from so many of the studies that supposedly show a benefit. All I can say is this, is present all this data to parents and let other people sort through it and make their sense of what they want to do. But I think parents need to know these different findings. And I got about 10 minutes left here. And again, I think as we think about medications, what do we want to do? We want to think, what are the benefits? That's what we've been going through, the benefit side. And then we have to look at what are the risks. And here are just some of the risks that you will see show up in different clinical trials, etc. So they have physical risks, you can read them. There's emotional risks, depression, apathy, that sort of thing. Psychiatric, OCD. One of the psychiatric, I think, is a big risk. So in the United States now, at least 10% of kids on stimulants for more than 2 years convert to bipolar. They have a manic episode or a psychotic episode. So that's a real recognized risk. And think about this, when they convert to bipolar, they're now seen as having a serious mental illness, a lifelong illness. That's a serious risk. And we do know there's withdrawal problems. What can we learn from animal studies? We talked about how it changed the brain. How about behavior? Well, if you give methylphenidate to rats during puberty, and I think rats hit puberty like at day 45, and I don't know how long puberty lasts, but it's very short. And then they take away the stimulant. What do they see in behaviors of adult rats? They see with great regularity some abnormal behaviors. And the way to basically describe the behaviors is this. The rats are less confident adult rats. They're sort of fearful rats. They're less curious, less reward-seeking. One of the things they do know, one of the ways they measure this is the adult male rats are much less likely to mount female rats, which is seen as sort of a lack of confidence, etc., etc. And you'll see this also in monkeys. And one of the thoughts here, by the way, is, and this is just, I think, somewhat speculative, but you do see this as people try to explain this. Why would this be? Well, think about it this way. The drugs increase dopamine, right? That drives your brain into a subsensitive dopamine state. So you have fewer dopamine receptors. The dopamine system is seen as the reward-seeking system, a system related to curiosity. So the worry here that was voiced by a couple of the researchers is maybe you're sort of damaging the dopamine state, and that leads to a greater risk of depression, apathy, less curiosity seeking. It's speculation trying to explain these animal results. This was a summary. They looked at all the animal research, and they summed up what can we learn by animal research, and you can see why they're coming to this conclusion. They're seeing decreased sensitivity, etc., etc. And this last part means they're more anxious adult rats. And again, it's rats, it's monkeys. We can decide whether it's a worry or not. This is some of the evidence in terms of the conversion to bipolar illness, the risk of having a manic episode. You'll see 6% stimulants. The second part is interesting. So let's say you're all bipolar children, right? We look at all the children that are now diagnosed with bipolar. Let's say there's 190 of you. When researchers when they looked at how did they become bipolar, about 2/3 had, as you say, manic and aggressive reactions to stimulant medications. So it's kids diagnosed with ADHD having this adverse reaction. And you'll see once again, another University of Cincinnati story looking at that as well. So here's what I did on this. On this side, I just looked at what are the recognized ways that stimulants arouse you? And when we think about stimulants, of course, you have an arousal moment, the drug leaves, and then what happens? You have a dysphoric moment, you sort of start to crash. So here is recognized arousal dysphoric symptoms with stimulants. And then over here I went to the NIMH website where it classified what are the symptoms of bipolar disorder in youth, in kids, juvenile bipolar disorder. And you see how they map right on one of the other? The arousal is practically the same. The dysphoric are practically the same. So you can see how the recognized side effects of stimulants could lead to this bipolar diagnosis. By the way, we have had just an extraordinary boom. Are you diagnosing juvenile bipolar in Denmark? Are you starting to do it here? We've had this extraordinary increase now in this diagnosis. So I tried to just sum this up. Benefits. You see the short-term improvement of ADHD symptoms. There's possible short-term improvement in reading, or really should be 14-month improvement in reading. That's MTA. The last one is the Swedish study. That's what I can find on the benefit side. Harm side. A number of studies saying no benefit on any domain of functioning. You can see the physical, emotional, and psychiatric effects. The risk that the brain's dopaminergic system will become desensitized and conversion to juvenile bipolar disorder. If parents were given this information, do you think they'd be much more cautious about starting this? I think this is a different way of thinking about it, right? And my big thing as a journalist is we just need a full disclosure, so to speak, a full discussion of what science is telling us about this. So, 1987, this is when we began really medicating kids. So in 1987, there were 16,200 children on disability due to mental illness. But now we're going to medicate a lot of kids with stimulants, and then next we're going to start medicating teenagers with SSRIs, antidepressants, and we're going to also increase the use of antipsychotics, particularly for behavior control of poor kids. And as this has happened, the number of kids going on to disability due to mental illness in the United States has exploded. You'll see that we're now around 700,000. We went from 16,200 to 700,000. And if you follow those youth that go on disability at age 8, 10, 12, about 2/3 go on to adult disability at age 18. So really what you see in this data is a new career path that has opened up in the United States, and the career path is this. You get diagnosed with ADHD or you get diagnosed with juvenile bipolar, and you have a career often as a career mental patient. And that really is a new career path. We didn't have that in the United States 30, 40 years ago. Anyway, so that's really the review of the literature for ADHD. And all I can say from my personal point of view, this is the one time I sort of get on a soapbox. You know, we have a societal sort of responsibility to take care of our kids, right? And to nurture them and give them every possible chance to grow up and thrive. I don't see in this data that we're meeting that responsibility. That's just my interpretation of the data. So, thank you. Thank you.
Kan man se det på hemsidan?